Hi everyone, I'm Slade Carter from the CVD Prevention Team at Public Health England, and today we have Tracy Davis to talk about Snomed CT in primary care. The webinar session will take the format of a 20-minute presentation by the guest speaker and a question and answer session at the end where everyone will get an opportunity to ask a question. So please unmute yourself and take it away, Tracy.
Thank you very much, Slade. So welcome everyone. As Slade said, my name is Tracy Davis. I'm a senior project manager that works at NHS Digital, and I work with a small team who are involved with Snomed CT in primary care. Could you take us to the next slide, please? One more, please. Slide before, please. That's lovely, thank you very much. So just a brief slide on what Snomed is. I would expect that most of our colleagues on the phone are fully aware that Snomed is a national common vocabulary. But the special thing I think about Snomed CT at this point in time is that it is enabling interoperability. So it will be a content that will cover all the clinical professions and all the specialities across all care settings. And that's what makes Snomed CT the coding of choice. DM&D is a separate product, and that's a dictionary of devices and medicines, but that also uses Snomed CT. So again, what we're talking about here is interoperability and consistency across the whole code sets. Now clearly why we're here today is because this is going to replace the current read codes. So next slide please. Other way please. That's lovely, thank you. So why is it replacing it? Well, it's replacing it under a national standard, and that standard is under the Health and Social Care Act. The key thing is that the standard required the implementation dates for providers of healthcare. That was that GP system service providers must adopt Snomed by April 2018, and our other organisations, our secondary care, acute care, etc., will need to adopt this by the 1st of April 2020. So clearly primary care is leading the way on this. Social care will take on the standard, but at the moment there are no specific dates for that. Okay, next slide please. So why replace read? Well, I think the Snomed being the coding system of choice is because it is interoperable. But what we've got to consider as well is the business need, and currently we have 3 clinical vocabularies for electronic patient records, 2 of which sit in primary care. So there's a lot of resource, a lot of time, a lot of money put into maintaining the vocabularies and ensuring that they're fit for clinical purpose. And it makes a lot more of a business sense if we just have one. And that one will have content for all healthcare and all specialities, and it will save us time and money, and also ensure that the data that's exchanged is increased rather than data having to be degraded because the codes are not co-similar. But also we need to think about technology. Read has been around for a very long time, and one of my colleagues always talks about it in relation to smart, to your phone, to your mobile phone. So if you think about when we first all got mobile phones, we were back in the Nokia 600 little block that we had in our hand. Well, that's read. And if you think now about your iPhone 8 with its shiny covers, that's Snomed. So that's the key difference, and it is a substantial difference. And because of the power and complexity of Snomed, it enables us not only to address the shortfalls in read, but also to have a lot more granularity in the way that we use clinical coding across healthcare settings. Because of that, it will improve patient care, it will enable electronic data sharing, it's international, so supports rare activities as well, and it will improve patient care through the improved data analysis. Okay, next slide please. The key point this slide is making is that initially the standard, the Sky Notice, had said by April 2018. The Sky Notice has been amended to from. April 2018. Now that might not seem like a significant change, by and from being very small words, but the reason would be, if you are in primary care, the one thing you do not need in Q4 is a new coding system when you're coming to the end of year for the quality and outcome frameworks. So the estate was consulted and it was agreed that it would make much better sense, both business and clinical, if we deployed from April after the quarter end had been taken. So that's what we're looking at now. The first phase that we're going to be doing from April will be first of type testing. Excuse me. We will be taking 5 GP practices live as first of types for each of the 4 clinical providers. We will be starting those first of types, i.e. testing that functionality to make sure we haven't broken anything, from April. Okay, next slide please. So, the from in April. This enables a phased implementation, and it means that we will preserve both Snomed and Read for a period of time. So we're calling this is called dual coding. So what we will have is all the clinical systems in primary care will both code in Read and in Snomed. Now we're expecting that dual coding will last probably till about 2020. When our clinical suppliers go live from April, the key things that they will put in place is that dual coding, that period of time supporting both code sets going forward. They will also put in place functionality that enables any national specifications that are provided in Snomed coding, that they can be supported and the GP practices can adhere to what is required of them. It will also enable that the new clinical content for general practices that is released in Snomed can be recorded by end users and processed. So all new codes that are coming out in Snomed will be enabled to be used. That's phase 1 type implementation, will take place from April moving forward. We would expect then to do first of type testing, sign up in deployments and roll out across suppliers. We would expect those deployments to be finished by late autumn 2018. So by autumn 2018, we would expect all GP practices to be using Snomed CT as their primary coding system, whilst also recording data historically and going forward for a period of time in Read or CTV3. Okay, next slide please. So just to sort of step back a little bit from that and talk a little bit about what our role is. So NHS Digital is an organisation that who, if you were to ask us what our key role is not to break the NHS with changes to systems and infrastructure. So it's very important to us that we get this right. And getting this right means enabling. So we're the gluey bit in the middle that works with the primary care suppliers, subsidiary suppliers, CSGs, CSUs, GPIT service providers. We also work with arm's length bodies, Public Health England, NICE and others, to ensure that people are aware that it's coming, that they have the advice that they need when they need it, and that we support them through the changes that they need to make to enable the Snomed implementation to go ahead without doing any significant damage. And obviously one of the reasons we're here today is working very closely with our Public Health England colleagues around NHS health checks to ensure that people are aware of what they will need to do moving forward. Clearly, one of the other things we need to make sure is that the national programmes like GP to GP and Summary Care Record, etc., are also ready to move forward. Okay, slide 8, thanks. So we have regular meetings with clinical suppliers, and in particular in assuring their products. So we don't just release the software out into the estate. That software is looked at and assured, and we have hazard logs and safety cases to make sure that the software will function as it's supposed to. And obviously first of type is part of that assurance. We will also be assuring funded Lot 1 system changes. So that would be Docman, Informatica and DX International, to ensure that their systems still work. One of the major aspects that we've been doing is providing training, and I won't read through that list, but there's a whole variety of training, and the Dellen site a little bit further on this slide deck would take you to that. Obviously another key role is communications and getting the information out, broadcasting, and also information and communication direct with various bodies. So that's the main focus that we've been doing to date. Let's take us forward, please. Next slide. So one of the areas that we have been looking at and working with for some time has been NHS health checks. And the work that we have done with colleagues on the call have clearly indicated that there is many different ways across the community and many different products being used across the community to deliver NHS health checks locally. That has raised some concern, and there has been a survey to look at the products and the methods used to deliver NHS health checks locally to try and assess where there may be points of difficulty. So part of that is these webinars, these sessions, to ensure that you are able to plan ahead. And that planning ahead needs to be about key people who are involved in regionally or local responsibility for NHS health checks and delivery of NHS health checks need to gain some awareness. They need to understand what the change to Snomed CT means, and they need to get on board with webinar sessions, particularly if they are in a position where they are designing queries and searches for GP practice systems. People who are involved with NHS health checks need to review and identify how your queries are provided. The queries run on the GP practice systems and provide back the cohort who will need to be pulled for the relevant NHS health checks. What we've identified working closely with the Public Health England colleagues is that there's a variety of different methods. So we've kind of split these up into a number of groups. One is what we would class as commercial third-party software, for example, Apollo, Health Intelligence, and others. Then we would have what you would call those that are using their GP clinical system reporting tools. There's also those that may have queries provided by their CSU. They may just be doing it in-house at a local practice level, or it might actually be somebody in the local authority who is running these queries or designing these queries and ensuring that the GP practice runs them. And you need to understand who and how the queries are provided. And you also need to understand not only who's responsible, but are they using MyQuest? MyQuest is a query language which is currently quite widely used, certainly in CSUs and in local general practice and local authorities. And the key additional problem here is that MyQuest will no longer be available after the end of the GP SOC framework. That is due to expire December 2018. Whilst some clinical suppliers are saying they will continue to use MyQuest, the point to bear in mind is it will no longer come under a contract with NHS Digital. So each supplier will be able to do their own thing with it, and that may create inconsistencies across different system suppliers and their equivalent GP practices. So you need to understand if they're using MyQuest, and you need to understand how you're going to move away from it. One of the other things that this is an ideal opportunity to do is to read the data quality guidance that's on our website and think about how you use codes and think about what you may need to change about your codes, and basic data quality and good housekeeping. It's a very unique opportunity.
Hello?
Hi, next slide, please. Lovely, thank you. So, still on planning ahead, still looking at what people on the call need to be thinking about. So we've talked about the fact that you need to get as much awareness about what's happening as possible. You need to look at how you locally do this, and you need to particularly understand the timelines. So because of the dual coding, current NHS health checks should continue to work. But when we introduce new SNOMED codes, that may not necessarily be the case. So you need to understand the variety of timelines around who provides your NHS health checks and what their timescales are for changing. So confirm with your provider about queries and reports. What plans do they have to migrate? So if, for example, it's with a subsidiary supplier like Health Intelligence, you would obviously expect them to have a plan in place to migrate, and you would want to understand what that plan is. You would also want to know, do you use MyQuest as a query language, and if so, when are you going to replace that? You may find that once you've had these conversations, you are in a good position and you can tick the box, and we expect that to be the state that most people will be in, but there's still a requirement to validate and check that that's the case. It's also worth understanding what your CCG is doing. Basically, the CCGs are responsible for ensuring the transition to Snomed CT moves ahead. Each of the CCGs has a named Snomed lead, and basically NHS health check should fit into their plan for moving forward. So it's always worth a chat with that person and saying, how are you dealing with NHS health checks across the patch? Certainly it's worth being joined up. If you're in a position where you are one of the minority whose current processes just will not work going forward, and that may be, for example, a GP practice where the codes are developed locally using MyQuest, or in a local authority where somebody's using MyQuest to develop local queries, you need to understand, if that's you, what your options are for replacing your current process. But understanding your current process is obviously the prerequisite to that. Okay, next slide. So this is a through to the practice of delivering those NHS health checks and wider to local authority commissioners of those NHS health checks. So this document I put there because it's actually useful for everybody, but what is particularly would be useful is if people on the call would look at these slides and think about sharing them with other people that they have contact with around NHS health checks or any other clinical work where they know those people may be using coding. Are they aware that Snomed is coming, and have they seen this sort of information? So a general, have a chat to all your colleagues and make sure they know Snomed is coming and what impact it will have on their areas of work. Next slide, please. This is a slide that gives you our main website resource. So there is a web link there. What I tend to find is the web links don't work unless you've got them in presentation mode. So if you get your slide deck and if you try to open that link just from the sort of read and design, it won't open. But if you put it into presentation mode, that link will then work. The good things in particular that I'll just point out is the browsing and maps lookup. So if you're developing queries for NHS health checks and you're currently using CTV or recoding, you can press on that link and it will take you to maps where you can put the read or CTV code in and it will bring up the equivalent mapped Snomed code. Now these maps have been assured by the joint GP-IT committee as fit for purpose. So all read and CTV codes have a match with a Snomed code that enables you to see which codes you should or could be using. So it's a very, very good tool. And on the education and training, it's got a whole raft of seminars, webinars, animations, YouTubes, etc., which we've tried to do it in such a way that we've got something that will reach everybody and something that is meeting everybody's needs. And one of the things we would say, if stuff that's on there, stuff that you need isn't on there, do get in touch with us, because we would be very happy to look to see if there's something else that needs developing. Okay, next slide. Of particular interest to the people on the phone may well be these new webinars. So dates on here and times. Introducing Snomed in general practice. You don't have to be in a general practice to go on that. If you are an NHS health checks person, you have a relationship with your general practices, and you may well want to watch one or more of those webinars. Designing queries and searches. Clearly, if you have a responsibility for being involved in that, you would want and benefit from attending one of these webinars. And exploring Snomed CT content for general practice. That goes a little bit wider on looking at what Snomed content in primary care looks like and how it can be used to the benefit of clinical and business purposes. Okay, I think that's the last slide. If you move forward. Okay, I think that was just over 20 minutes, Slade.
Yes, that's right. Thank you very much for that presentation, Tracy, that very insightful webinar on Snomed CT. We're now going to